Good morning, everyone, and thank you for the opportunity to be here today. My name is Sevan Kolejian, and I'm a director at the FDA Division on Medication Assessment and Medication Error Surveillance. I would like to start with a disclaimer that the presentations reflects today is my own views and should not be construed to represent FDA's views or policies. With that, I'd like to start a little bit about what we do at FDA in terms of medication error prevention. When we think about the product life cycle, FDA in post-market setting receives medication error reports. We review the medication error reports. We have a team of multidisciplinary medication safety analysts who conducts the risk assessment from the reports received in the post-market, and in the pre-market setting, we have a team of analysts who reviews the reports, who reviews the medication error perspective, the product labeling, container labels. I'm referring in terms of, and I speak a little bit later on in my presentation about it, as well as instruction for use for the product and the prescribing information. So let's talk a little bit about what we do in a pre-market. So obviously in a pre-market setting, we consider the reports and the lesson learned from the post-market reports. And based on that, we kind of consider the entire medication use process when the product will be marketed. We think in terms of who will be the end user for that product will be. We think whether it's a patient who will be preparing the product, self-administering it, or I guess relevant to your case would be potentially anesthesiologist preparing at the procedure site and administering it. We also think about the various environment of use, and the environment of use could be at home or could be in a healthcare setting, could be at a pharmacy or the physician office. And primarily, we think about how that product will be used in terms of the user, how they will be interacting with it, how complex is the preparation, how complex is the information needed for safely to prepare and administer the product. So medication error can happen in any stage of the medication use process. And obviously, we can't predict all possible medication errors in a pre-market setting. However, by conducting the risk assessment on the product and understanding the end user perspective, that helps us to prevent the medication error in the post-market setting. We primarily review product labeling. We ensure that all the product relevant critical information is presented on the user interface. And by user interface, we are referring to all the components that the user will interact. This is an example of a container label. As you can see on this example, there is a primary display panel, which is the middle panel of a container label, could be a vial. And the user will rely on the information, critical information present on the display panel to make a decision whether it's correct product, what's the strength of the product, and how potentially will administer. When we review, we ensure that the proprietary information, established name, strength of the product, as well as cautionary statements are present if needed. You can also notice there's a side panels, and the side panels might have additional information, such as potentially recommended dosage or other relevant storage information. But our focus is to ensure that end user, when they're interacting with the product, container label and carton labeling, as well as prescribing information and the instruction for use, they're able to locate all the information needed for them to prepare the product, prescribe the product, as well as safely administer the product. So we receive over 100,000 medication error reports in post-market. even though this is a voluntary reporting system, and we know that there's much more occurring in the marketplace. Nevertheless, as I mentioned before, those post-market reports are very valuable for us because they actually inform the work we do in the pre-market review space. We encourage that all healthcare providers, as well as patients and consumers, to continue reporting medication errors, and not just medication errors, any circumstances that potentially may lead to medication errors. And by circumstances, I'm referring to, for example, lookalike label and labeling. Not necessary the error happened, but if you observation is that potentially may lead to medication errors, we encourage you to consider submitting to FDA. We do realize that we receive a small subset of medication errors. What's happening is more. Nevertheless, every report, it provides a very important, valuable information for us. I'd like to share an example of a medication error report. We don't receive many from anesthesiologists, but this is a very good example of a report that anesthesiologists reporting that a patient experienced seizures and cardiac arrhythmias after a patient received a tranexamic acid instead of bupivacaine for spinal anesthesia. And the report also says that this is a very serious national health emergency, and every hospital and healthcare provider needs to be urgently alerted, and that the FDA should take immediate action. So our analysts, when they receive this report, they will review and assess the report. They will think in terms of what type of error it is, or where potentially this happened. Was there any recommendation from the reporters? What was the contributing factors? And what type of a regulatory action FDA might take? And the type of regulatory action can be various. Could be in terms of making revisions to the label and labeling, or providing a safety type of a communication to healthcare providers, as well as in certain instances, we might consider revising the design elements of the product, could be the packaging or the way its user interacts with it. In terms of considerations when we are evaluating this type of errors, we specifically kind of trying to understand if these errors happen, is there's any additional reports that inform us. Most of the reports we receive doesn't have all the information as needed, unfortunately. When we look at it, sometimes the reporter says this might be a potential for error, but it does not provide any additional information. For us, a good report is that has all the information needed for us to analyze. And it doesn't have to be multiple reports, it could be one good report. And the example previously that I provided, in this case, after evaluation by the analyst, FDA made a decision to issue a safety alert, which alerts all the healthcare professional about the risk of the medication error with the tranexamic acid injections. Preventing medication error is a shared responsibility. It's not just on one organization, on one institution or individual. In our minds is we want to encourage and facilitate medication error reporting. We would like to establish and foster partnerships to share medication error information and support research to advance the science of medication error prevention and analysis, and including the causes of the errors and effectiveness of the mitigation strategies. We consider using novel approaches when we're reviewing it, and other approaches that potentially can minimize medication errors. Our intent is prior to medication goes on the market to do what we can to prevent the error from happening. However, those reports that we receive in the post-market space informs about our review. That's why it's very critical to receive those reports. So just a couple of key takeaways. As I stated, preventing medication errors requires collaboration and shared responsibility. We encourage reporting of medication errors, including circumstances that may cause or lead to medication errors. It doesn't have to happen an error. It's important to prevent it when you observe first potential error from happening. And regulatory actions that FDA might take may include revisions to the product container label, carton labeling, instruction for use, prescribing information, and as well as safety communication, and requesting a product design updates that may include the repackaging or other aspects of the product. The information we learn from the post-market surveillance informs our pre-market review process, and we aim to reduce the likelihood of medication errors occurring with a medical product prior it hits to the market. And with that,
Terrific.